These are things that are on your face for seconds. The coldest water you can tolerate and then the shortest shower you can tolerate.
Most people have some sort of skin complaint when wearing these masks all day.
It's a fine balance. You want to remove the dirt and grime and bacteria, but you don't want to overwash. Any cream that is thick will also do a good job. It should be so thick that when you turn the jar over, it holds its form and it doesn't come out. Suck your blood, essentially, and they deposit antigens that are specific to trying to keep those veins open so that they can eat.
You don't want to be using harsh soaps that are going to scrub and strip the outer layer of your skin, because that can actually make you more sensitive to whatever you're coming in contact with.
What that does is essentially sucks the moisture out of your skin. That causes sort of the same appearance that you would get like with a dried riverbed, so it has little cracks in it, especially if you're using a moisturizer afterwards to kind of repair that skin barrier.
Face masks are the newest accessory we quite literally can't go without. This summer's hottest mandatory trend, helping to stop the spread of COVID-19.
Those things have worked, and they made it possible for us to begin to reopen our economy.
But they take some getting used to.
Most people have some sort of skin complaint when wearing these masks all day.
Brigham and Women's Hospital dermatologist Abigail Waldman says she's been getting questions nonstop, especially from hospital colleagues. Skin irritation from the masks is being dubbed maskne. She says the best way to prevent it is keeping your mask and your face clean. That means wearing your throwaway surgical mask once or when it looks dirty. And wash reusable masks every day, preferably in sensitive detergent.
The mask can press on the skin and actually occlude the hair follicles, causing the breakout. Another thing is that you can get buildup of makeup and lotions and all sorts of other allergens that are coming from the outside on the inside of the mask, and you can get somewhat of a sensitivity to those allergens.
She recommends washing your face before and after wearing a mask with a simple, gentle cleanser, then moisturize.
You don't want to be using harsh soaps that are going to scrub and strip the outer layer of your skin, because that can actually make you more sensitive to whatever you're coming in contact with.
The type of mask can be causing you irritation. Lighter material like cotton is best.
It's a fine balance. You want to remove the dirt and grime and bacteria, but you don't want to overwash.
A dermatologist at Brigham and Women's Hospital, Dr. Abigail Waldman, says most people should wash their face only at night.
It should feel soft. If it feels tight and dry, that suggests you're overwashing or using too harsh ingredients.
Instead, the product you choose should be simple and inexpensive.
You do not need to spend a lot on a cleanser. These are things that are on your face for seconds. Most of the active ingredients are really not doing a whole lot.
Look for oil as the first ingredient if you have normal or dry skin. It does a great job removing makeup. But get a water-based cleanser if your skin is oily or prone to get acne. In that case, it also may help to wash your face twice a day.
You can tolerate it generally, especially if you're using a moisturizer afterwards to kind of repair that skin barrier.
But no matter what your skin type is, avoid going too old school with water and bar soap.
And the reason for that is that it has a very high pH and the skin has a lower pH. And so that can disrupt the skin barrier and make your skin feel very irritated.
So if you see redness, blotchiness, or dry patches, don't immediately think you have sensitive skin.
It might be that the washing's actually the culprit, and backing off will help.
We also asked Dr. Waldman about these very popular single-use face wipes. You see them everywhere in stores. Well, she compared them to wet wipes for your hands. They're convenient, good in a pinch, but they shouldn't replace scrubbing at a sink. Emily Reamer, WCVB, News Center 5.